Hello, this is a presentation regarding COVID-19, also known as coronavirus, in regards to keeping your family healthy, presented on behalf of San Joaquin County Public Health Services. What is a coronavirus? Coronaviruses are a large family of viruses. Ones most known to us are Middle East Respiratory Syndrome, MERS, or Severe Acute Respiratory Syndrome, SARS. The novel coronavirus, or COVID-19, is a new strain. It was originally transmitted from animals to people. How does this virus spread? The virus spreads mainly from person to person, between people in close contact with one another, through inhaled droplets, or touching your face after touching an infected surface. This virus can last up to 72 hours on certain types of surfaces. Just as a reminder, viruses cannot be cured with antibiotics. Exposure risk is harder to contain than bacteria. The immune response is systemic, meaning the whole body is affected, not just certain parts. Most colds and flus are predictable. However, before winter 2019, the novel coronavirus had not been seen in humans. Symptoms that are common with COVID-19 are a fever, cough, and shortness of breath. So how can you prevent getting COVID-19? Wash your hands. Washing your hands often with soap and water for at least 20 seconds, especially after you've been in public places or after blowing your nose, coughing or sneezing can help prevent contracting COVID-19. If soap and water are not readily available, you can use hand sanitizer, and it must contain at least 6% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. If they're not dry, then it's not working. Also avoid touching your eyes, nose, and your mouth with unwashed hands to prevent infection with the virus if you touch the surface that had COVID-19. It's important to explain to your children that hands that look clean still have germs. Teach your children how to wash their hands properly to keep them healthy. Help look off the thing to make sure you wash your hands for at least 20 seconds. Or Mary Had a Little Lamb, if you're happy you know it. ABCs, Happy Birthday, Row Row Your Boat, Twinkle Twinkle Little Star. And Forever Drop. It's also important that you cover your cough and your sneezes. Cover your mouth and your nose with a tissue when you cough or sneeze, or use the inside of your elbow. Make sure you throw the used tissues in the trash. Immediately wash your hands with soap and water for at least 20 seconds after you've done. It's also important to clean and disinfect surfaces, especially surfaces that are frequently touched, like doorknobs, tables, and that. If surfaces are dirty, clean them with soap and water. Use gloves when picking up used tissue or emptying waste baskets. Linens, eating utensils, and dishes do not need to be cleaned separately, but you should not share them without thoroughly washing them. It's also very important that you avoid close contact with people who are sick, and this is called practicing social distancing. Stay at home if it's not essential for you to go into public places. Essential places to visit are grocery stores or pharmacies to get necessities, such as household items, food, and medications. Make sure that when you are in proximity to other people that you keep at least a 6 feet distance between you and that person. During the COVID-19 outbreak, Governor Gavin Newsom issued a stay-at-home executive order, which is effective throughout the state of California. This does not mean that everything is closed, but it does mean that non-essential places are not open. So things that are essential, as mentioned previously, are grocery stores, pharmacies. You can go to restaurants for takeout, delivery, or drive-through, farmers markets, banks, laundromats, gas stations, essential government services, and public transportation and utilities. Things that are not essential are things like dining in restaurants, theaters, bowling, gyms, and nightclubs. In order to be prepared, it is important that you create a household plan. It's important that you talk with people who need to be included in your plan. Meet with your household members, other relatives, and friends to discuss what to do if a COVID-19 outbreak occurs in your community or in your home and what is needed for each person. Create an emergency contact list. Ensure your household has a current list of emergency contacts for families, friends, neighbors, carpool drivers, healthcare providers, teachers, employers, the local health department, and any other community resource that you think you may need. Plan for ways to care for those who might be at greater risk. Older adults and people with chronic medical conditions like heart disease, diabetes, and lung disease are at higher risk of getting very sick from this illness. Although essential places are still open for business, you still want to take measures to limit your frequency at these places. Make a plan so you don't have to take multiple trips to these places. Again, you should plan for those in your home that are at higher risk. As mentioned previously, older adults and persons who have underlying chronic medical conditions such as heart disease, diabetes, lung disease, and HIV and AIDS may be at greater risk for more serious complications. It's important that you stock up on supplies and non-perishable foods for these people, such as medications that you or your family may need. Take everyday precautions and use best practices, especially for those that are at greater risk. People at greater risk should definitely avoid crowds and are encouraged to practice social distancing and avoid all non-essential travel. If you care for a loved one living in a care facility, monitor the situation. Ask about the health of other residents and frequently and know the protocol if there is an outbreak. It's also important to contact health care providers to ask about getting extra necessary medications for people in your household. Be sure to have over-the-counter medications and medical supplies such as tissues, pain relievers, and other medications. If you cannot get extra medications, consider using mail order for medications instead of going in person. Have enough household items and groceries on hand for everyone in the home so that you will be prepared to stay at home for a period of time. Again, these places may be open, but you should not frequent them as often as you would if there wasn't an outbreak. You should also know your community during this time and get to know your neighbors. Talk with them about emergency planning. If your neighborhood has a website or a social media page, consider that to maintain access to neighborhood information and resources. Identify aid organizations in your community as well. Create a list of local organizations that you and your household can contact in the event that you need access to information, healthcare services, support, and/or resources. Also consider including organizations that provide mental health or counseling services, food, and other supplies during this time as well. It's important to know the ways to reduce the spread of COVID-19. COVID-19 is highly contagious, so we want to be able to use best practices when we're in the community. If you or someone in your home gets sick, stay home except to get medical care. People who are mildly ill with COVID-19 are able to recover at home, about 80% of people. Do not leave the house unless you need medical care, and don't visit public places. Stay in touch with your doctor. Call before you get medical care, and be sure to get care if you feel worse or if you think it's an emergency. Avoid public transportation if you feel ill. Avoid using buses, ride-sharing, or taxis. Separate those who feel ill, and people who are healthy in your home. Keep the ill away from others. People who are ill should stay in specific sick rooms and away from other people in your home. Use a separate bathroom if available. Limit their contact with pets and animals. You should restrict their contact with them, and when possible, have another member in the household care for the animal when you are sick with COVID-19 or someone in your family is sick. If you have to care for your pet or you need to be around animals when you are sick, wash your hands before and after you interact with them. This is because the virus can live on the fur or skin of the animal, and someone else comes and touches that animal, they can then be exposed to the virus. There is no evidence that animals can actually contract COVID-19. Call ahead before visiting your doctor. If you or a family member has a medical appointment, call the doctor's office or emergency department and tell them you or a family member may have COVID-19. This gives the office or emergency staff opportunity to provide themselves masks and other protective equipment to protect themselves and other patients, and also prepare any kind of transportation vehicle. You can create your own cloth face mask, and your cloth face mask covering should fit snugly but comfortably against the side of your face, should be secured with ties or ear loops, include multiple layers of fabric, at least 2, and allow for breathing without restriction. It should be laundered often, at least once or twice a week, or every other day, and machine dried without damage or changes to the shape. And CDC recommends wearing cloth face coverings in any public setting where social distancing measures are difficult to maintain. It's important to note that cloth face coverings should be used in conjunction with social distancing and other means of protection. Avoid sharing personal household items. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with people in your home. This is because the COVID virus can actually live on all of these surfaces. And make sure you wash these items thoroughly after use. Wash them thoroughly with soap and water or put them in the dishwasher. Regular dish and laundry detergents should be fine, especially if you have a heating cycle that can be sure to kill the virus. If you're ill, monitor your symptoms and seek medical care right away if your illness is worsening. For example, if you have difficulty breathing or you have bluish lips. Some emergency signs of COVID-19 include shortness of breath, persistent pain or pressure in the chest, new confusion or inability to rouse or wake up, or bluish lips and face. Again, make sure you call the doctor before you go in to the emergency department or into the doctor's office, and call ahead to let them know that you have COVID-19 symptoms or that you were diagnosed with COVID-19. If possible, put on your face mask before you enter the building. And if you can't put on the face mask, try to keep a safe distance from other people, at least 6 feet away. Follow care instructions from your healthcare provider and local health department. They can give you instructions on checking your symptoms daily and reporting information to the needed places. If you have a medical emergency, call 911 right away, and of course let the operator know that you think you might have COVID-19, and put on that face mask before the medical provider arrives. If you have COVID-19 and you have fully recovered or you think they have fully recovered, isolation can be discontinued after 3 things have happened. Number 1, you have had no fever for at least 3 days, and all your other symptoms have improved. And it's been 7 days since your first symptoms appeared. It's important to remind ourselves that we need to support ourselves during this time, not just physically, but also mentally. Your well-being is very important to your physical overall health. Things you can do to support yourself include taking breaks from watching, reading, or listening to the news, including social media. Hearing about the pandemic repeatedly can be very upsetting. Take care of your body. Take deep breaths, stretch, or meditate. Try to eat healthy, well-balanced meals, and exercise regularly. Get plenty of sleep. That means between 7 and 9 hours. And avoid alcohol and drugs because they can have a lasting effect on your immune system. Take the time to unwind each day. Try to do some other activities that you enjoy. And remember to connect with others. Talk face-to-face with friends using Skype or FaceTime or other video chat platforms. If you need extra support or a family member needs extra support, there are some great hotlines to reach out for resources. The Substance Abuse and Mental Health Services Administration, or SAMHSA, has a disaster distress hotline. They have this in English and in Spanish, and it's available 24 hours a day, 7 days a week. They also have resources available on their website. The National Suicide Prevention Lifeline is also English and Spanish and has great resources available online. Locally, public health is doing a lot of different things. Here's some highlights. Public Health Services is maintaining regular contact and following the guidance from the Centers for Disease Control and Prevention and the California Department of Public Health. We're conducting public health services planning meetings with our programs and partners to allow for enhanced response coordination countywide. We're working to ensure that our healthcare system, first responders, and schools have guidance that they need through presentations, phone consultations, and meetings. We're maintaining communication and outreach with federal, state, and local partners, including the County Emergency Medical Services and other regional organizations. Public Health Services is distributing information and updates to healthcare professionals and educational settings. We're also reviewing and adopting current pandemic plans for COVID-19. It's also important during this time of uncertainty to stay well informed. For up-to-date and correct information, use the resources below. Visit the following websites for updated information. www.sjcphs has local information at the county level. SJ Ready is the emergency services website for resources as well. Or you can always call San Joaquin 211, dial 211 for community resources. Thank you.